My name is Kelsey. My last name is Murray. I'm going to be talking about deaf mental health and how getting well business, rehabs. The American Disability Act, or ADA, says that a person who is deaf has the right to have communication access that is equal. Similar, for an example, a person in a wheelchair, they have access to ramps, and it's the same, the equal access. However, sometimes that doesn't always happen. Sometimes rehabs, they won't have an interpreter for a deaf person or a deaf client. I called a rehab around here, and I said, I'm not going to say which one I called, but I asked, if you have a deaf client come to your facility, do you give the interpreter, or how does that work? And he told me, no, they must have an interpreter. I'm not going to provide an interpreter. And I told him, oh, I see. Okay, well, that's, the law says that you can't do that. You must give the interpreter, but whatever. Anyways, one study had shown that only 17% of deaf signers have interpreters for healthcare services. So some rehabs have intake, an interview, where they decide if you are an addict or if it's mental health or whatever. So for deaf clients, they have to have an interpreter there to answer for them. So maybe sometimes the information is wrong. Well, the interpreter doesn't understand. Maybe they're wrong about what the deaf client had to say. Or the deaf client feels like they're not okay sharing their feelings like that, their story with the interpreter. Again, that person, maybe they just met, they're not okay with sharing their story with the interpreter, maybe. Deaf Client Services, or DCS, is in San Diego, and they have services for deaf people. They have things like counseling, support groups, and they have crisis intervention. They also help with deaf people finding work, jobs and training for those jobs. They have different things outside of behavioral health. Alright, so there's a rehab called Signs of Life. It's the only rehab in America, in the United States, for deaf and hard of hearing people. Only one. So they're in San Diego, but it's in San Diego. It's kind of funny. And they have patients, outpatient and inpatient programs. It just depends on your insurance. Maybe the money, what it'll pay for, it just depends on your insurance plan and your health plan, whatever it'll accept and cover. So they have things like counseling. They help with finding work and improving your skills. You could become a better worker, training and help with that. So you can also go to AA or NA meetings. But maybe struggling with doing the 12 steps, this 12-step program, maybe they can't communicate with a sponsor. It might be hard to communicate. Maybe they can't find a sponsor or like someone to lead them through the program. Who knows? Sign. I myself have struggled with addiction. I want to interpret for AA and NA meetings. I want to help deaf people become sober. If you're an addict, it can be hard. You can really feel alone and depressed, but sobriety, it can really help the stress and pressure. You just feel relief. And that's all I have.
Hi, my name is Chandler Burns, and today I'm going to be talking about the culturally biased testing of deaf patients, specifically in our Western culture. Deaf mental health is as important as hearing mental health, but they are not treated the same. Why are they treated differently? There are varying reasons. Two of the reasons I will be discussing today is how past IQ tests set an attitude about deaf mental health, and how health providers lack the skills to correctly evaluate a deaf person's mental health. In the book entitled Damned for Their Difference, The Cultural Construction of Deaf People as Disabled, a man named Henry Goddard ran IQ tests for eugenics. He was racist. He wanted to see people's intelligence with these tests. He divided these groups of people based on race and ethnicity, using the results to prevent the entry of immigrants coming to America. One of these groups was comprised of deaf people. Spoken language was critical to succeeding on these tests. People thought deaf people were stupid because they didn't use spoken language. These tests affected the Western culture and its perspective on deaf people. With these tests, deaf people were assumed to be stupid, so they didn't receive the help and support they needed and deserved. Deaf people are not stupid or dumb. They use sign language, which is a complex language. They were thought to be ineducable and were shut away in homes for many years. They had no access to mental health support and they suffered. Though there has been much improvement in recent years in awareness, opportunities, and access for deaf people in the community, there is still work to be done. Effective psychiatric evaluations are incredibly important. In an article entitled "The Psychiatric Assessment of People Who Are Deaf or Hard of Hearing," medical providers feel that they lack the knowledge, ability, and skill to effectively perform an evaluation on deaf patients. Few providers feel confident to do this. Because of this, deaf patients are overlooked and not given the fair care and support they need. Deaf people suffer from mental health issues like everyone else, but they are not treated the same because of culturally biased testing of deaf patients. Western culture biases impact the testing of deaf patients' mental health, and they are not given the care they need. Hopefully this can change in the future. Thank you.
Hi, my name is Amelia, and today I will be discussing bipolar disorder and its relation to deaf patients. A while back, there was a study done for deaf patients who went to the University of Cincinnati Hospital during the years of 1983 to 1999. 28 patients were included in this study. 11 out of the 28 patients were diagnosed with bipolar disorder. After the study ended, a new person came to review the study. He reviewed the same 28 patients. The new person had no idea of their previous diagnosis. He interviewed them using the same interpreter for everyone. All 28 deaf patients were pre-lingually deaf. Backtrack, 2 patients became deaf later in life. Their diagnosis is not included. Moving on. For patient diagnosis, 11 were diagnosed with bipolar disorder. 11 were diagnosed with major depressive disorder. 2 were diagnosed with schizophrenia. 1 patient was diagnosed with schizoaffective disorder, intermittent explosive disorder, substance-induced mood disorder, and dementia brought on by HIV. Twelve of the 28 patients had substance-related comorbid disorders. Patient deafness. From the 11 patients that were diagnosed with bipolar disorder, 8 of them were men. From those 8, 5 had congenital deafness. 3 of them were deaf from head trauma or infection prelingually. These 11 diagnosed with bipolar disorder previously had very different diagnoses from each other. This study and the review of this study prove deaf patients often are misdiagnosed. This can happen because of unskilled interpreters, cultural bias based on how deaf people express themselves, linguistic bias from a language deficiency or delay. This is important to use CDIs. CDIs can help bridge the language levels. Currently, 75% of deaf people in mental institutions experience language deficiency or delay. What are a few noticeable signs of deaf people who have bipolar disorder? A change in their signing behavior, such as rapid signing or incomplete thoughts being signed. But this information comes from hearing people. Again, it's important to use CDIs for help.
Hi, my name is Julia Stone. My sign name is JS on my chest. Today I'm going to be discussing non-psychotic behaviors. Non-psychotic behavior is a condition of the mind that affects the way a person feels, thinks, or behaves without causing that person psychosis, which is a sense of losing contact with reality. Or not being connected to the world around them. Non-psychotic behaviors can show as obsessive-compulsive disorder, or OCD, depression, or anxiety. Anxiety can have some things that they can have with anxiety are panic attacks, insomnia, and phobias. Deaf anxiety. Deaf anxiety was first made, the term was first made by Artie McWilliams in 2017. He described it as being paranoid or worried that hearing people will think they're a nuisance because he needed clarification for some things. A study was done throughout the years 1995 and 1997. And out of 7,905 deaf and hard of hearing individuals who took the survey, 10% of them reported to have felt fearful. Only 1% of hearing individuals out of the 42,815 who took the survey had reported the same. Women are shown to have more anxiety. OCD in deaf adults. OCD is a type of anxiety which can have 4 different things. Unwanted or intrusive thoughts, a need for order and symmetry, irrational phobias of dirt or germs, such as illnesses. They don't want that and they have to be extremely clean, and a lack of self-control. It can be especially difficult to diagnose OCD in deaf adults, because of the communication barriers between between psychiatrist and patient. And there are some symptoms that are the same. Depression in deaf adults. 21% of the 7,905 deaf from the previous survey said they often felt hopeless about the future. And 20% said that they were, quote, feeling blue or feeling sad. .4% of hearing people had said that they felt hopeless about the future. And 2% of hearing people who had taken the survey said that they felt blue or sad. 42,815 hearing people took that survey. There's a significant lack of information and studies on prelingual deaf ASL users. And there's a significant lack of studies on ASL users on any type of mental health. There are some deaf psychiatrists, but there aren't a lot, and it's hard to access. Thank you for watching.